This is what you look like if you're facing the back wall. So this is the back side of your body, okay? Get the perspective right, okay? This is the back of your shoulder, the back of your head. That's where your bum would be. This is the back of your knee. So for today, we're gonna highlight a very specific area in your body. So today we're gonna be talking about SI joint pain. What does that mean? Your SI joint, this is your tailbone right here. I have it in a circle. This is your hips, and in the middle, that little shell-like structure. Its main purpose is to help your left and right side of your hip to function in a synchronized manner so that when you're walking, you get that sort of swaying back and forward action. If this wasn't there, what would happen is that you would have a solid movement. You can't walk without your tailbone. So there's very little movement that happens with the tailbone. But the thing is, when it becomes restricted, you get the massive consequences of dealing with a lot of pain. So we don't really appreciate this area unless it's dysfunctional. So in today's video, I want to show you how you can learn to mobilize it, how to stretch it with a very simple hamstring stretch. But before we get into that, I want to cover a bit of a theory that I think is important for you to understand, because the more that you know, the more that you can apply. So a bit of the theory. We got ligaments in our body, we got tendons, and we have the fascial system, okay? Andrew, don't get this wrong.
Bone to bone.
What does a ligament do?
Bone to bone?
Is it bone
No.
to bone? Come on. What is it?
Muscle to muscle?
Okay. Andrew has to study. So this is a ligament, it's bone to bone, okay? Bone to bone. Meaning at a joint, we have articulation, connections with a strong structure called a ligament that helps to keep the joints solid together. It's called a ligament. What is it? What's a tendon?
Tendon's muscle to muscle.
There you go. Wait, what?
Is it?
Muscle to bone.
Muscle to bone, yeah.
Muscle to bone. At the end of every muscle, we have a cord-like structure that helps to connect the beefy part, the meaty part of the muscle. It turns into a bit of a strand and it connects the muscle to bone so that we can do a bicep curl, so that we can do hamstring curls. It connects muscle to bone. This is what I want to highlight, okay? The fascial system. Why do I want to talk about the fascial system? What does your hamstrings have to do with your tailbone? What I want to talk about is the fact that your hamstrings will indirectly lock your tailbone down, and sometimes it goes unnoticed because we tend to think, my tailbone hurts, my SI joint hurts, let me do stuff locally to help relieve it. Your hamstrings, let me draw this, will attach from the back over here, come up, attach to the hip. So the muscle itself doesn't connect to the tailbone, but fascially, this fascial system, this helps to connect muscle to muscle. And what that means is that your hamstrings will continue past your tailbone and up your back via the fascial system. Does that make sense? This muscle connects with your back muscles, crosses your tailbone via the fascial system. What I'm saying is, I'm going to show you a really good stretch to help stretch the fascia, help condition the fascia, to help, I guess, prime how the connection with these muscles are, how they're functioning, right? Because a lot of the times when it becomes chronically tight, this tailbone becomes chronically restricted. A very simple stretch. Hope this makes sense. All that you need is a band. You're going to get on the floor. And this stretch typically is a very easy stretch to cheat. So what I want to show you is the setup. You're going to get into this position. You can cross. You're going to get into this position here. And what most people do is that they use their back to sort of lean over and try to stretch their hamstrings. The issue with that is that nothing is happening with the hamstrings in themselves. Therefore, you're not getting the benefits of the stretch. Your tailbone, nothing happens to the tailbone, nothing happens to the actual muscle itself. Take your band, wrap it around your heel. It's a bit of a difficult stretch to do. You're gonna wrap it around your back. You're gonna hook it across the opposite leg. Naturally, when you're in this position with the band pulling, your legs are gonna naturally want to open up. This might be aggressive for some people, but for me, it's fairly comfortable. So use your judgment. Your legs are gonna naturally wanna open up. You're gonna instantly feel a bit of a deeper stretch on the inside hamstring. We can take it to the next level. And all that you wanna do is, I like to turn it into a game. And what I like to do is use my forearms as a sort of measurement tool to sort of gauge how much I'm stretching it and to make it symmetrical. For example, try to not use your back too much. Try to bring your chest to the ground. Keep your body up, erect, straight, and lean forward. And use your forearm as a guideline for the right side and for the left side. And as you're coming down, you should feel a bit of a stretch on the inside hamstring, okay? If you want to get a bit more aggressive to isolate the SI joints and releasing it specifically, if you are dealing with SI joint pain, turn your leg sideways, okay? Open them up a bit more. Take your chest to your knee. As this band is pulling me out, I'm taking my chest to my leg, and I'm gonna feel a stretch on the outside of my hamstring now. Keep repeating it until you feel some sort of release, and when I say release, you feel like things are letting go. Once again, my tip is don't use your back too much. Be intuitive. Feel for the stretch in your hamstring. And before we wrap up, I want to show you what an example of someone that's chronically restricted looks like. It's not a good thing, but it's good as a reference. So I'm going to get Andrew, my cameraman, to show you what you don't want it to be like. So this is Andrew. So he's my demo of what you don't want to look like when you're dealing with hamstring tension. Okay. Was that difficult?
Yeah, kind of.
Kind of hard. So it's a bit more of an advanced stretch. Okay.
Reach with my chest.
Reach with your chest. Try to get your forearms on the ground. So you're far from the ground. So where do you feel it?
On the inside.
On the inside.
Of the hamstrings.
Try to arch your lower back. So round it. Stick your bum back.
That's a bit more on the middle side of the hamstring.
Okay, so it's more middle, okay? So now what I want you to do, take your foot, take the tips of your toe and point them out. Yeah. So now take your chest and point it to your right foot. Where do you feel that?
More on the outside.
More on the outside, okay? So what he's doing, he's mobilizing his hamstrings, he's stretching them, he's conditioning that tissue to condition this connection. It's an F. Muscle to muscle. So we're indirectly stretching hamstrings to release this because it's all connected, okay? Comment below if this makes sense and let me know what you think.